Good morning. My name is Ada Skiles, and I'm the Associate Director of Chapin Hall at the University of Chicago. On behalf of Chapin Hall, I would like to welcome you to our Child and Family Policy Forum. We would like to thank those of you who are here in person and those joining our live video webcast for taking the time to be with us today. Today's program is entitled Measuring Child Well-Being at the Neighborhood Level. I know you will find today's conversation both lively and informative. Moderating our panel of experts on this topic is Chapin Hall's Executive Director, Matt Stagner. Again, thank you very much for participating in today's program. I'll now turn the program to Matt, who will introduce our experts on this topic.
Thank you very much, Ada, and welcome to everyone. This is the first of our series this school year of Child and Family Policy Forums, and we're very excited to be talking about an important topic with people who can address it from a number of areas. I'll make a few statements of framing, and then we have four speakers. One, a foundation executive, Elena Harkness from the MacArthur Foundation. We have a private agency director, Nancy Ronquillo, who is from Children's Home and Aid Society. We have an intermediary, maybe he'll explain what that means, Chris Brown from LISC Chicago. And finally, a research perspective from Robert Gurga of Chapin Hall. So what we'd like to talk about today is our increasing ability to measure child well-being in very small geographies at the neighborhood level, at the sub-neighborhood level. I want to call your attention to the title and the focus on child well-being. What we'd really like to talk about today is to get beyond simply the measure of inputs into communities. What are we doing there? Who's spending what dollars? Who's doing what activities? And outcomes, really to get to the question of, are we improving child well-being? How would we know if we're doing that? How would we know if what we're investing in or the services we're doing are working to improve child well-being at the neighborhood level? So with that, the bios of the panel are in your packet, so I will not read their lengthy and impressive bios, but they're there for you. There is again an audience on the web, a very large audience from what I understand from around the country. And there's the ability of those folks to ask questions via the web, either by sending an email or posting on our Twitter account. So the Twitter hashtag is Chapin Forum, and if you have a question, send it in. Each speaker will speak for about 8 to 10 minutes, and then we will open it up for them to ask questions of one another, for the audience here in the room at the Gleacher Center to ask questions, and I'll try to weave in some of the questions that might come in from over the web. So with that, I will turn it over to Elena to begin.
Thanks. Good morning, everyone. So the first order of business is to downgrade my title, so from executive to program officer. Since it's debate season, I know someone's fact-checking this, so I just want to make that clear.
You're an executive to us.
So I'm a program officer in our community and economic development area at the MacArthur Foundation. I do work primarily here in Chicago. Our issues that we focus on here are a range of quality of life issues in the neighborhood. So we primarily support an initiative you're going to hear more about from Chris Brown. It's called the New Communities Program, and we've been at that for about 10 years, working in some of Chicago's most low-income neighborhoods on a range of issues to improve the well-being of residents that live in them. So the MacArthur Foundation has, I'm going to set some framing sort of context for all of this, and it's going to be a little bit of a higher level, but MacArthur has focused on research and data and has had an interest in supporting sort of the information context of all of the work we do for a very long time. So this is sort of not a new area of interest for us. We have supported a couple of projects you may know. Of course, Chapin Hall has been part of this. We have a longstanding interest in integrated data systems and support the work of Dennis Culhane at the University of Pennsylvania to understand from the human services perspective particularly how integrating city, state, and multiple levels of data can help us understand how to measure child well-being. So that's one project that's actually out of a different area, at the policy area at the MacArthur Foundation. So it's really a cross-cutting interest for us, and I'm speaking mostly from my perspective in community development, but we really, across the foundation, have a cross-cutting interest in supporting data, supporting information, and thinking about how we assess the impact of our work, and also how we support our grantees' ability to assess their own impact and understand how they're making a difference. So I want to open with a bit of an anecdote about how I got interested in data as a topic, 'cause it's something that I'm really interested in myself. And some years back, I was working at an organization called the Partnership for New Communities, which was at the Chicago Community Trust, and we were working on the major public housing transformation in Chicago, which those of you in Chicago will know well, and I think even those of you listening in nationally, it was a very major endeavor to transform our public housing stock. And we were working on an initiative called Opportunity Chicago, and it had a very measurable goal. It wanted to help improve employment outcomes for 5,000 public housing residents. 5,000 residents. It was a very clear goal, and it was over 5 years. And why this was important, it certainly was not the whole story. It was not telling the story of every single thing that happened in those residents' lives. That was a much more complex picture. There were many data sources that we could draw from to understand what was happening. But having that one clear, measurable goal allowed us to set a table and bring together a group of stakeholders that were really essential to achieving that goal. So we had the Chicago Housing Authority, the Mayor's Office of Workforce Development at the time, a range of other partners from the city, from the state, nonprofits, all of us concerned with the same goal, all of us with greatly sort of different abilities to sort of track and measure that goal, because the city and the state have access to their own data sources, nonprofits have access to theirs. And so that initiative, I mean, it both showed me the importance of what an outcome and a sort of numerical target can do to set the table, but it really showed how being able to track our progress over time allowed us to actually course correct and make decisions collectively about how to do our work differently. So one example of this, as we got sort of a better, and the data systems improved greatly over time, so as we got a better picture of how residents were attracted to particular kinds of workforce development services. Certain sectors were not of interest, so we found that people really were not, the profile of residents we were working with were really not interested in long-distance overland trucking jobs. There were a ton of jobs in the sector. If you did an industry analysis, it seemed like this was a great place for entry-level positions. People were not interested. So we were able to target and shift our strategies appropriately, but it was only because we had access to great sort of data in real time that we were able to do that. And so that initiative, I think on so many levels, there's a great evaluation report that's available on the MacArthur Foundation's website that tells part of that story, but it really showed the power, I think, of having an orientation to data and not allowing it to drive everything, but really allowing it to sort of be a way of setting the table and keeping an eye on how we need to change and adjust our strategies accordingly. So with that said, I think a couple of important points about sort of measurement and a focus on measurement. It can't be, data in general cannot be sort of the be-all and end-all of everything that we're working on. And it also comes from a variety of sources. So data is not entirely numerical. I think we have tended to focus on numerical targets, and data can be words as well. And so much of the important information that we get about evaluation and understanding what matters does come from qualitative sources. So I think one of the key points we've learned and want to emphasize is that it's really both qualitative and quantitative. It's important to be able to use data to sort of tell your story, but also to evaluate. When we think about building capacity to use data and to be able to use data to inform our work, I think the role for foundations really needs to be to support that capacity on the front end. And I think for a long time, it's been the focus on evaluation and what has happened at the back end that has caused a bit of a backlash and a turn away from it. We don't want to measure data. We don't want to focus on data because isn't all this other work important too? It absolutely is, but I think information has become so ubiquitous that having good capacity to use it is as critical as leadership and the money that you get to do the work. I mean, it's really something that we need to pay attention to on the front end of an initiative, from planning through implementation to sort of ongoing performance management and assessment of what we're doing, all the way through to the back end and evaluation, and then telling the story of what happened. And I think that front end focus, and for foundations and public sector funders, I think it's really important to be able to say, not only it's important to focus on it in the front end, but we actually need to then invest in building that up on the front end. And I think that that has not necessarily been an even sort of story across the board, and I think has led to what we've experienced as a bit of backlash away from not wanting to measure things. So that's really our orientation, is to try to support that from the front end, and you'll hear more from Chris later talking about how we are working in the New Communities program areas to try to build that into practice and build models of how to do that with practice. The second thing I would say is all of you, as people interested in human service and child and family well-being, are interested in people outcomes primarily, but we all know that place matters so much for the context of well-being and how people are doing and faring. And I would say that I think the understanding of how people and place outcomes interact is very complex work. So I don't think this is as simple as saying we can build better tools to measure and we can bring them in from the management sector or someplace else. I think there really is a lot of tool building going on right now, and it requires strong partnerships between researchers, evaluators, and the nonprofits themselves that are doing the work, and the public service providers that are actually implementing on the ground. So I think this is a time of generating new tools and new ways of doing this work. I really don't feel that it's sort of as simple as identifying something that's out there. There may be great tools out there. So Matt and others had asked me to reflect a little bit on what I think of as the information sort of ecosystem in Chicago right now, because as providers think about how they do this capacity building and how they build capacity to use data smarter, one of the things is that you're not going to do it all in-house, right? You're not going to be able to build up the capacity to track everything you want. It requires strong partnerships with a number of different partners. So I think one of the things, when I reflect on the landscape in Chicago, we're very fortunate because we have strong public sector leadership right now, actually at multiple levels of government. So we have a city and a county that are interested in making public data much more widely accessible and available, and allowing people, from entrepreneurs to build things with it, from nonprofits to use it to understand what they're doing. That's wonderful. They're putting those data outputs. It's a valuable public asset, and there's a real sort of commitment to putting that out there, and I think that's wonderful, actually, at state, county, city level. So we're very fortunate there, and that's a trend that I think is happening across the country. At the same time, we have what I think of as issue-specific data intermediaries. So we have Chapin Hall with its really strong focus on children and families. We have the Chicago Metropolitan Agency for Planning, with the visionary leadership of the Chicago Community Trust, has built up the Metro Pulse indicators that let us know at a sort of regional level, how are we doing, how are we faring, and how are we moving towards the goals of improving this whole region. So that's wonderful that we have that. We have people that work on specific issues around housing, around childhood obesity. I mean, the list goes on and on. But I think it's important to understand what each of those intermediaries brings to the table. Is it issue expertise? Are they able to interact with the nonprofits that need to draw on them to get that expertise? And how do we think about building the skills of people that can be really important translators between them? There are some interesting organizations that have kind of cropped up to bridge some of the gaps. Organizations like Code for America and DataKind, who have, I don't know if you're familiar with those groups, but they've sort of sprung up to fill the gaps between the public sector putting out data that nonprofits aren't quite sure what to do with. It's out there, it's raw, it can be really useful, but we really need good translators and people who can make good application interfaces and tools that help that data make sense and turn it into information. And I think that is going to become a really interesting area of work where people are sort of building a lot of entrepreneurial activity to make those raw material that the city and state and county are putting out useful for human service providers and others to do your work better. So I think that's an area of really exciting work right now. So I think, how am I doing time-wise? Doing okay? 1 minute. Okay, so I guess to wrap up, it's a wonderful time in Chicago. It's a wonderful time nationally. It's very exciting that there is so much sort of enthusiasm, I think, around data, and it's everywhere. And building up the capacity to use it more effectively, I think, is within reach. What's the challenge? The challenge is going to be for funders of human service activity and all other social change work to pay attention to this capacity building on the front end, to allow people to have the room to spend resources, to use information all the way from the beginning, from planning through implementation to evaluation. That's really important, and I think that's important whether you're a private sector funder or a public sector funder. There's some exciting, I think, momentum around public sector support for this. So our Chicago Cook Workforce Partnership here has just been the recipient of a Workforce Innovations grant to build an integrated workforce development data system. That's really promising for us, and I think for the human services sector that cares so much about human capital development, that's really exciting. On the nonprofit side, what's the challenge? I think the challenge is really to understand as much as you can, what is this information landscape? Where are all of the different sources where you can be getting data to inform, and information to inform your work, whether it's primary collection yourself, making better use of the information you have inside your organization, and going to these partners, to research partners like Chapin Hall and all of the other universities we have, and to the data intermediaries themselves that are building up the capacity to be great brokers of this information and to use it to make smarter programming decisions. So those are the overall sort of framing comments. I hope that helps set the context.
Very good. Thank you very much, Elena, for setting that context. And now we'll turn it over to Nancy to talk from a provider perspective.
Good morning. It's a real pleasure to be with you this morning. And I have a couple of things I'd like to say. I think Elena's remarks are spot on. I wanted to talk about a community in particular that Children's Home and Aid is doing a great deal of work, and that's in the greater Englewood area, and talk about the impact of data and what data can mean through a collaborative and how it is informing and driving practice. As an example, kind of a microcosm of how Children's Home and Aid is thinking about data and trying to use data and becoming data-driven. And so the couple of things I'd like to say from the get-go is let's recognize the time in history where we stand. And the time in history where we stand is the greatest economic turmoil since the Great Depression. Which has translated into enormous pressures on public spending and private spending. And so when we have data, data has a kind of a double-edged sword. There's the potential to learn, to drive improvement, and to be creative and to do innovative work. And then there's the potential that the axe is going to fall right across your neck because your outcomes are not exactly at a number that one might have expected given what the data says. So I just want to do a reality check for us all, because as we as an organization embrace data, want to learn about what it means, so the data is pretty useless if it's just a pile of numbers and we shipped it off to a funder. What does it mean for practice? What does it mean for results? What does it mean in the lives of the people we have the privilege to serve? That's a learning journey. And so we will invite and encourage and appreciate when our funders understand that it's not just a decision point around whether to continue funding. It should be a decision point about how we're learning as a human community about what we can do for kids and families. So a couple little data points about Greater Englewood. Fewer than 10% of the youth entering high school in Englewood are reading at grade level, and less than 60% of those young boys and girls will graduate in 4 years. Nearly half of all the families who have children who are 5 years old or younger are living in poverty, many of them in extreme poverty. Low birth weight and infant mortality in Greater Englewood is twice as high as in the rest of Cook County. Births to teens in Greater Englewood 3 times as high as the rest of Cook County. In 2011, 60 murders, that's about 5 a month, 1 a week. I'm sure it's not scheduled that way. 77% of the children interviewed in a survey reported having heard gunshots. These were children under the age of 6. So when we talk about trauma, the impact of violence on the development of children in their well-being, we know that we have a community extremely challenged in terms of achieving really good outcomes. With that as some context setting, I will describe 2 local partnerships. The Children's Home and Aid, again, has the privilege to serve as an anchor agency. The Neighborhood Recovery Initiative, which again is a wonderful opportunity with some funding from the state to invest deeply and try to push the numbers in the right direction regarding violence. We have 12 partner organizations 117 of the youths we served in the first year, 73% of those boys and girls completed the program, have a job, are in school. The parents who were involved in the parent leadership development, 86 of those parents completed the program, have a job, or are in school. And so when Matt teed this up to say, we kind of have an idea about inputs and maybe something that got better. The table that we've set with the Neighborhood Recovery Initiative is a table that says we will share information about what our respective engagements are to see whether as a community we are moving the dial. We are getting things done in a way that is sustainable and one that can be enduring. So kind of from outcomes to impact, community impact. Similarly, we have helped to forge the Southside Early Learning Network. This is, again, Southside, Englewood primarily. This is a network of 10 home visiting programs, and the intention is to join the home visiting programs with the early learning community, the Head Start and Early Head Start and early childhood centers, so that the bridges between home visiting work and children entering into that, what we hope is a cradle to career pipeline that is more intentional, and again, we can share learning and we can do the debate about if you are achieving X and we are achieving Y and we need to go to X, how can you help us? So there becomes this generative cross-learning capacity building that occurs. And Matt early teed us up by saying, well, how would we know if we were really getting the kind of impact that we wanted? And I thought to myself, well, in Englewood, one way we would know is there would be fewer children killed or wounded by gunfire. We would know because there were fewer children removed into foster care in Englewood. We would know because more children were graduating, more youth graduating from high school, more kids making it from 8th grade into 9th grade. I mean, there are some metrics that we could focus on to say, are the kids doing better as a community? I would also say that in order for us to drive those numbers in the right place, it takes a table where we are respectful of each other, appreciating strengths, trusting enough to say, here's my data, let's see yours. And to have a data platform where we have a common set of measures. We aren't going to all measure the same darn thing, but if we could have a core common set, we can speak a core language around progress. And that's where a lot of learning is occurring right now, and it's absolutely fabulous. I wanted to touch on another example. It's a community collaborative. It's called the St. Clair County Youth Services Coalition. Children's Home and Aid is a statewide organization. And many years ago, 2001, we said there are too many young people going into detention and then into prison and starting the cradle to prison pipeline. What could we do to keep kids out of prison? And so we were one of the first sites for the Redeploy Illinois grant. And in that process, 153 youths from the St. Clair County area did not go into detention. They went into school and they remained at home. The statewide number for Illinois over that same time period is 382. So I'm here to say that, St. Clair County doesn't have the majority of kids who are headed to detention, but I can tell you that this community table where we own as a community an improved outcome for young people and leveraging the assets of unique providers has been the way that we have taken the number down 80% in the St. Clair County area. And it also has sparked now a willingness, and we did win for the coalition a reentry grant. So we don't want kids going into jail, and we don't want kids going back to jail or prison, those who have come. So right now in St. Clair County, 50% of those youth return to jail. There is a reentry recidivism rate of 50%, and the grant will call us to drive that down by 25%. Of course, our goal will be 100%, right? We don't want kids in the prison system. A new opportunity, I would just lift it up in the realm of where can we make more gains. The Chicago Allies has helped form, again, with wonderful partners, research partners, funding partners, the Civic Council for Youth Success, and essentially establishing a data trust or data bank where all youth service providers in the Chicagoland area can have a common set of metrics and start learning from each other, engaging where we get the greatest result. And the Peace Hub initiative is being braided into that. Some of you may be familiar. That's very, very focused on reducing violence, the experience of violence with youth. Weave that in, and 5 very distinct neighborhoods: Englewood, Little Village, Grand Crossing, Roseland, and Lakeview. Data really does matter, and I think we are hugely challenged by having numbers, data, become meaningful, and meaningful not only to the folks who serve in leadership positions in their organization, no matter the sector, but most importantly in the hands of the practitioner. And so I had the great pleasure to speak with Pat Messina earlier this morning around a subsequent pregnancy project that was born of practice, born of doing the work, seeing what was happening, checking the research on subsequent pregnancies of teenagers, and devising a model that, again, in a world of resource constraints, we are seeing funding cuts on this program, but we've got a decade of research that says if you do this, you will prevent a subsequent pregnancy, you will increase graduation rates, you will increase positive learning, lifetime earnings. The data is there. We have lessons to learn about how to share it and how to use it and inform policy, and how we can have the enduring and sustainable investments on things that work. 2 things I would also kind of just wave the Illinois flag. TANF caseloads between 1997 and 2001 dropped by 86%. One would never know that for the kind of discourse we have around people dependent on welfare. That's a huge win. The policy insight and what data helped undergird was an enormous and leadership investment in early childhood programming, allowing the adults, the parents to go into the workforce and the young children to have a great opportunity to start out with much more learning and supports. That's phenomenal success. It gets lost in the hue and cry of where we don't have enough resources. Similarly, on the child welfare side, in the mid-90s, we had over 50,000 kids in care. Many of you may know this. We now are at 15,000. Data, performance-based contracting, and nothing that had to do with legislation or even a contract requirement. The mere listing on a regular basis to the providers of foster care, public and private, who was meeting the permanency threshold. And if your organization was at the bottom of that list, the execs, whomever, went back to their shops and said, we're not going to be at the bottom of the list. What are we going to do to meet the threshold and be in the normative range for achieving permanency for children in foster care? So this is the generative opportunity in Illinois, particularly with the Child Welfare Advisory Committee, a wonderful table, public, private, research institutions, to look at the data in Illinois. And right in front of us today, and I'm happy to say Illinois did win a 4E waiver, there's a 3-year window where the federal government is willing to invest through waivers in innovation where we can test practice in the most rigorous way with research to say what can improve us in terms of the outcomes for well-being. So I'm out of time, and I just think in closing I would say, maybe chiming in on Elena, let's not have the data go into a black box. Some funders got it. What's it mean for me? I don't know, but I got my report in. Let's have data be meaningful at the care and practice level. Let's have it be shared among our partners.
Fantastic. Thank you, Nancy. Now we turn to Chris Brown of LISC Chicago.
Thanks, Matt. Matt, I first want to thank you for introducing me as an intermediary, because it means I start the conversation with no one here knowing what we do.
If I knew what you do, I'd tell them.
You'd tell people.
I thought it was better that you do that.
Frankly, you're the last person I want knowing what I do. We actually have had a great relationship with Chapin Hall. I work at LISC, the Local Initiative Support Corporation, and I direct our New Communities program there. Elena alluded to it earlier. The New Communities program is an effort to support comprehensive community development in neighborhoods around Chicago. And to do this, we work with 16 community-based lead agencies, each of whom is implementing a quality of life plan for their neighborhood. And the intent of the quality of life plan is to put in place programs that make their neighborhoods better places to live, work, and play. So they're really engaged in processes with a lot of stakeholders in their communities to say, how would we make our neighborhood a better place? How would we work together? And then how would we know that the neighborhood is a better place when we're done? And so they do a lot of work in a wide variety of programs: housing, safety, education, almost anything you can think of, they're engaged in one way or another. Before I go further and start talking about data, I think it's important to tell you that I actually like data. Many people don't, but I actually do. I'm a huge baseball person and love baseball, and I think that nothing goes better with baseball than data, except perhaps hot dogs and beer. So ever since I've been a kid, I've always loved looking at box scores and thinking about stuff, and that, I think, translates into a lot of the other work that we do. It's already come up a couple of times from the two earlier presenters, but I think it's important for everyone to realize that the groups that we're talking about, the folks who are working in communities and serving children and families and everyone else in neighborhoods, these groups are awash in data. Having access to data is not the problem. They have program data that they collect on who they serve. They have funder reports, Nancy, that they fill out and often then file in a folder. We have community demographic data. We have reports on how schools are performing. And most recently, we've added a city data portal, which has more data than you could ever hope to see about what's going on in Chicago. As one example, one of our lead agencies, which does a lot of work in the field of education, currently has to collect and manage 30 different data sets to document and demonstrate the work that they're doing. That's a lot of data, so having data is not the issue. It's really the lack of capacity to analyze this data that I think is the issue we have to address. And I think one of the places that we have to start is that we don't really give neighborhood partners the time to analyze this data. We have a lot of expectations that they fill out reports and, more importantly, that they actually do the work that we've given them money to do, so that they're out there very busy, so they don't really have time to analyze the data. The other thing is that these folks that we're talking about that are doing this work, they have different evaluation techniques. It's not that they're afraid of evaluation. Most of the groups that we work with have their own system of evaluation, but it's mostly qualitative stuff. They talk to people they work with, and they ask them, how's it going? Are we doing what you want us to do? And are we being successful at that? The other thing is that these folks, they're trained in doing programs. That's what they're really good at. They're not trained in analyzing data, and so we have to think about how we build their skills to do this analysis work that we're talking about. And if they don't have these skills, they're not going to be able to do the kind of program improvement that we're all really interested in using data for. Now, I'd like to take a few minutes and just talk about some of the issues that I think folks have with data and the use of data. And the first, and Elena talked about this a little bit, is that oftentimes in the discussion, local knowledge about issues gets discounted. If you can't back it up with a report from a well-known research institution, no offense to my friends, it doesn't have value. And I think we've seen the exact opposite of that. Oftentimes our groups know a lot more than what the numbers will tell you and can provide you the context about why those numbers matter or don't matter, as the case may be. Another issue that I think our groups have with data is that it's really hard to tie any program activity to long-term change, particularly at big community levels. This is because people move. People move a lot. The average American moves every 7 years, and in neighborhoods that we're talking about, people move much more frequently than that. We can't nail poor people to the ground and try and measure them over a period of time. Programs change too. We were having, unfortunately, a sad, joking conversation earlier about a program that was very successful, and it was so successful but costly that people didn't fund it, so they had to do something different. So we always have to take that into account. The other problem I think people have is that managing data is hard work. You always have to have people to input that data, be sure that it's put in right, because it's the old bad stuff in, bad stuff out. But you also have to have the skills to produce good reports from the data that you're inputting. Another issue that I think people have is that when people start talking about data, they feel like it gets them disconnected from people. The reason all of us got into this work, even if I love data, is because I want to connect with people. And if I spend all my time working with numbers, I'm not really doing the stuff that I really like to do. And then lastly, I think it's really, really important that we acknowledge the fact that in most cases, data gets used for punitive purposes. It's a cudgel that people are beaten with on a regular basis rather than a tool that helps people do better work. And I think we're all responsible for that, and we all have to take action to make that change. We are engaged, as Elena said, right now in an effort to try and build capacity to use data in a different way to support comprehensive community development. And we're calling it Testing the Model, and it's an effort that's gotten support for LISC from the MacArthur Foundation, for which we're very grateful. And in this effort, we're working with 7 community-based lead agencies, each of whom has picked a domain area to work in. 3 of them have picked education, 2 safety, 1 health, and 1 housing. And they've used a process to use data to think about what's going on in their community and then how they might design interventions to address those issues in their domain area, and then how they would improve their programs over a period of time to do better work, and then ultimately be able to demonstrate to people, you, me, anyone, that their work was successful, and successful not just with an individual or a school or a block in terms of housing, but for the community. The goals, as I've just sort of alluded to for this program, is that they really want to make a change in their domain area. It's not about just an exercise, a thought exercise in using data, but it's really about finding ways to improve their neighborhoods. They also want to be able to demonstrate, as I said, impact at a community or population level, that we can no longer sort of have just the story about, oh, look, we helped Chris and now he's better. We have to be able to talk about how our neighborhoods and our communities are better. And lastly, we want to be able to demonstrate, both in the short term and the long term, that the type of work that our groups are doing, where they're working in a comprehensive fashion, where they're working with community residents to design programs that they want for their neighborhoods, is a more effective strategy than other ways that people might try and implement in neighborhoods. We're just getting into this work. We've been doing it for about a year, but I think we already have some key lessons that I'd like to share with you about how we can work with data and work with organizations in communities around data. One thing is that we talk about LISC's work in 5 words. We say we engage, plan, act, communicate, and repeat. And I think if you're going to work with groups around data in neighborhoods, you really got to stick to a philosophy around that. You've really got to engage people in a discussion about what they want to do, why they want to do it, how they want to do it. You have to let them plan what they want to do, and then act and carry out that plan, have them communicate their successes, learn from their challenges, and then do it all over again. The reason for that, I think, is that if you just come in and impose a data system, there's no ownership. But if people build it themselves, they'll own it and work with it. They will own their own data system, and they'll use it. And that's perhaps the most important thing, because if you just put it in there, they'll do what you want them to do or what they're required to do, but they won't really use it for all the different ways they could. The other thing is that by engaging people in this process, community members will own the data. That communities, people have often been disconnected from data, and so having them engage in this process will help them be a part of the data. And it also builds positive relationships to data that get us over this negative association or this punitive piece of work that often happens. By also engaging folks, we build data leadership. We have folks own data and own data in their organizations in ways that they haven't in the past, and we begin to see them use data to make real programmatic changes in their work. And it also builds community accountability where they can hold each other accountable for what's going on. I just want to hit on, I know I'm running out of time, Matt, and I'll be really quick on a couple of other quick points. One is that we need to build capacity. I think we've all said this several times. We need staff with skills. They need to build skills on how to analyze data, and they also need skills on how to visualize data so they can make it apparent to other folks. It's not just enough to have a bunch of numbers that you throw on people, but you have to do that in a way that makes sense to all of us. That's why I like box scores. They make sense to me. One fun way that we've been doing this at LISC is we've created a thing called Data Friday, where we bring our partners together, have them present on data, talk about what they're doing, and help them learn from each other about ways they can use data better. We need to build systems, data systems. We need them to relate to each other. We need to reduce duplication so that people don't have to enter data over and over again. Really important, we have to hire data input staff. If there's nobody whose job it is to input the data, it just doesn't get done. It's always number 11 on the top 10 things to get done that day. And we have to make sure that we don't make data use punitive. I want to end by just saying, like I said to begin with, I love data, but I want to be sure that as we go forward in a relationship with data, that we fall in like with data and not in love with data. Both Nancy and Elena said it too. That data tells us a lot, but it doesn't tell us everything. We have to remember that people's stories are really important, and we have to listen to those stories to really understand what the numbers are telling us. I think in our work, we always want to be data-informed but not data-driven, because the data will tell us a lot, but like I said, we need to listen to the stories to understand the context. And we also always need to understand that there's going to be a lot of things that the data never will tell us about, and that's why we have to get out and talk to people to learn from those examples. So I'm going to stop there, and I want to thank you again for the invitation to be here, and I look forward to the conversation.
Thank you, Chris. I'm now going to turn it over to somebody who's liked data for a long time, Bob Gerga.
I'm continuing the baseball analogy. Sorry to those of you who don't like those analogies, but I'm batting cleanup here, and it's to suggest that I can provide some answers, and I'm convinced that I'm going to fail. And I also, though I think I'm in like with data, I do this work because straight out of college, I worked at the Children's Home and Aid Society as a house parent, and I'm a social worker and working with 8 emotionally disturbed children for about a year and a half. I'm still trying to answer questions as to why they're there, what happened to them, and how we can better serve those kids. So that's kind of the context for my work over the past 30 years. So although we're smack dab in the middle of the information age, and it certainly seems that there's lots of data around us, as the others have mentioned, I still don't think we have sufficient information to assess whether neighborhoods through schools, community-based and federal, state, and local programs are having an impact on the lives of children and families. Funders of programs are requiring more information on the impact of their program, the programs they fund. This burden, even if funded, is typically placed on the shoulders of service providers, as Chris has said, which is significant. Not only because of the potential cost of collecting data, because also data is collected by government is currently not accessible to most, if not all, service providers, even though more and more data is available as the Chicago Data Portal is a great example of. So when we're talking about child outcomes, and the government programs that community-based agencies attempt to affect, we're talking about the health and child well-being of their families. The outcomes that we're talking about have already been mentioned: educational outcomes, juvenile justice outcomes, whether or not a child that commits a crime is arrested, whether a child becomes a parent, teen pregnancy, but also events in the child welfare system, like whether or not they're placed in foster care or substantiated for being abused or neglected. When we're talking about health outcomes, we focus on whether individuals with certain conditions, like asthma, are getting proper treatment. Let me use attendance as an example of some of the issues. Attending school is a very basic activity that indicates whether a family has a routine that allows the child to get to school every day. Because attendance is very poor in some of our more distressed communities, it's a potentially good short-term indicator for knowing whether a program focusing on family functioning is successful. If being educated is part of well-being and attending school is related to learning, then attendance might be a good indicator. However, it works differently for different age groups. As children get older, attendance may not reflect family functioning, but it might reflect how attached a youth is to school, and it might be a good indicator of after-school programs. We found that a child if a child is attending his or her after-school program, they're more likely to attend school. If an adolescent is engaged in an after-school program, it might have a positive effect on their coming to school and avoiding truancy. Therefore, attendance indicates whether something else is happening for these youth than for families with younger children. So now, how do program providers or their evaluators get attendance data? This is kind of where it starts getting sticky. If the law in a particular jurisdiction allows, and this is true in Illinois and a lot of states, agencies need to get consent from parents or the child, if the child is over 18, to access data from schools. So this is, quote, to any person with prior specific data written consent of the parent designating the person to whom the records may be released, provided that at that time any such consent is requested or obtained, the parent shall be advised in writing that he, now, I'm not going to finish that. But you can see that there's a challenge there. One can imagine it's sensitive information protected by federal and state law. And for the families that community-based services provide, it's tough to get consent from parents to access this data from government agencies. There are similar laws for measures that also require consent, but some data like that from juvenile court even requires a court order. So that's kind of getting the data on the people side of things, on what children are experiencing in the context of families and their communities. So the other challenge is just defining what a neighborhood is. Nancy talked about Englewood, but sometimes, Chicago has these 77 Chicago area communities, Chicago community areas, for the last 100 years. They still have some meaning, but service provision in most cases is not organized by these community areas. They have no independent governance. They're the default for what we use. Most organizations, whether it's CPS needing to define their catchment areas, or a small child care center needs to define their geographic area of interest for their own administrative needs. We need to identify these communities in order to target target not only populations that are at need, but to find where the services of a particular organization fits. For lack of a better term, some of us have come to refer to this problem informally as the blobs problem. What blobs serve information needs the best at the neighborhood level? Flexibility is an important thing. How can data be organized in a way that indicators can be aggregated at the right geographic level for different issues in a way that supports better understanding, better policy, and better service provision? We often use census tracts and zip codes, but those are still pretty big. The block level is a smaller level of aggregation, and some census data, particularly decennial census data, come at the block level. Unfortunately, the American Community Survey continuous measurement has replaced the long form, and we don't have as much information kind of at a point in time, although we do have more information on a continuous basis. Geographic information systems, GIS, provide a lot of power to create your own geographic definitions, but the problem is going back to the issue raised above, which requires one to have point level data or block level data to aggregate the data to the geography of interest. One needs to have the skills Chris mentioned to use those tools. And it's tough to get addresses of individual students, for example. Once you attach those addresses to attendance data or graduation data or grade data or everything, arrest data, whatever we're talking about, it starts getting difficult to do. A fantastic development, as everybody has mentioned, has been these open data portals in many cities and some states. This is where government makes data available on websites and lets anyone download that data. Chicago, in particular, has made a great deal of geographically coded data so that with the right skills, again, one can construct statistics for nearly any aggregation of blocks. In Illinois, the governor recently put out Executive Order Number 3, which brings the state into the kind of 21st century, allows for agencies to use cloud computing and encourages more open data. We'll see how that goes. For example, in the portal, the Chicago portal, we have crime incident data for 11 years. Each crime record has a type of crime and the block in which it occurs. With GIS, you could aggregate these blocks into whatever neighborhood you might want and calculate crime statistics. However, as was mentioned before, there are no people characteristics associated with these crimes, so you can't separate the crimes where the perpetrator or the victim is a youth or a child. So it's difficult to use that data to really evaluate what's happening in particular communities. So there's a challenge there. So, for example, would it be possible to have block-level data on school attendance? We'd want to, again, separate that by age group. If we were able to separate it by age group, a group that did community organizing, like LISC, around school issues, might be able to evaluate whether or not they were making an impact. A major problem, however, is that the numbers of children on a block get very small. It's possible for those who, with enough motivation and skill, to identify children or at least make educated guesses about who has good attendance and who does not. This is what constitutes the concerns relative to privacy. When you think of other kinds of data that's been mentioned here today, such as juvenile crime or child maltreatment, the sensitivity of such data is greatly heightened. So statisticians and computer scientists are working on methods to address these issues of privacy so that data might be eventually be available, but also be secure. And we may still be a few years away from that. The New American Community Survey offers some advantages since it allows for continuous 5-year measures of demographic characteristics at a tract level. A website that Chapin Hall created in working with the city's early childhood needs assessment, the Chicago Community Needs Summary tool, allows one to pick addresses and then draw a circle with a half-mile, 1-mile, or 2-mile radius around it. You have that website on the handout. This is one way that we can use readily available tools to create customized data from the census and other publicly available data. Of course, if the data is not provided to the public by the government agency, the only route for a nonprofit or government agency is to partner with research organizations. And I think I don't have to give a plug for either Chapin Hall or any of the excellent research organizations, but sometimes it is necessary to partner with one of those groups, especially when we're talking about long-term outcomes. I think Chris made a great point about mobility, tracking clients, families over time really requires a longitudinal, statewide, and even sometimes multi-state view of data, especially when we're talking about some place like St. Clair where there's a lot of mobility across state lines. So there's not an overabundance of easy resources to use. I've pointed out some that are available in Chicago. There are resources available in many other cities. Cleveland has NEO Can Do, which I don't think we have a reference to, but if you Google NEO Can Do, and it'll pop right up. So in your packet, we have a number of websites mentioned. I just want to say a few words about them before finishing up. Young Children in Chicago, which is something funded by Chicago Department of Family and Support Services. We have comprehensive information about children 0 to 5. MetroPulse by CMAP has already been mentioned. They have great occupational data at the tract level in there. The data portal has not only crime data, but attendance boundaries and school report card data. I mentioned the Chicago Community Needs Summary tool, the tool that we did for the city. We put down the link for the census data, although the Chicago Tribune census data apps done by Joe Jamushka are a great tool and easy to use, and he's going to make them even easier to use. So I would direct everybody to that site. So while government has not made all the data we need to measure child well-being at the local level available, there's been significant progress made in the past few years to make more data public and more responsive to the measures at the local level. I think all of our job is to use what is available and advocate to government to make more available so that we know the state of the child and family in our defined neighborhoods of interest.
Thank you, Bob. So I'm going to give the audience here a little bit of time to think up questions you might have for the panel. We have a couple of folks circulating with microphones, so when you have a question, raise your hand. I will call on you, and then wait for the microphone to come so that folks both in the room as well as on the web can hear your question. Before we get there, I want to first find out whether anyone on the panel has follow-up to something someone else on the panel said or a question for another panel member. And if not, I will take the chair's privilege and ask a question myself.
Could I piggyback on the resources discussion that Bob just sort of laid out? So one more that I should have mentioned in my opening remarks and that we probably should have listed here is the National Neighborhood Indicator Partnership, which is a project of the Urban Institute. Most of you, I don't know if some of you are familiar with it, but just overall, what the National Neighborhood Indicator Partnership, or NNIP, seeks to do is to actually be a network of data intermediaries in cities across the country. And it's grown somewhat explosively in the last few years, I think probably in part responding to the growth and sort of paying attention to the need for data. But the group Bob mentioned, Neo Can Do in Cleveland, is one such data intermediary, and they're all structured somewhat differently. Some belong to universities, some are standalone nonprofits, but all of them have as their main objective this sort of focus on making data useful to drive neighborhood change and to be applicable at the neighborhood level. So those of you in Chicago will remember the Metro Chicago Information Center, which unfortunately closed its doors earlier this year, but they were a primary data intermediary in Chicago and had as their main mission this sort of focus on making data resources available, providing that kind of on-the-ground technical assistance to make data useful. So we no longer have them in Chicago. As I said, we do luckily have a number of other good sort of issue-focused intermediaries, and we have the Chicago Metropolitan Agency for Planning, which is also an NNIP partner. But I strongly encourage you to visit the site. They've got a very well-curated website that's fairly new and lists all sorts of resources from all over the country that would be very applicable. So it's called the National Neighborhood Indicator Partnership, and it's a project of the Urban Institute.
I have a question.
Sure.
So we are now awash in more data opportunities, resources. Does anyone in the panel have some examples of how organizations were able to build the skills at the neighborhood level? What does the data mean? Let's say we have, again, a piece of paper with some numbers that are interesting. Are there models or resources where staff and communities, neighborhood folks can come to learn how to be good with data?
Chris, do you have some examples
I think
of that?
a couple of examples. One would be the Logan Square Neighborhood Association, which has done a lot of education work over the years, has done a really good job of collecting their own data. To Bob's point about trying to get attendance data, for instance, out of schools, it's been tough, and they've gone out and just figured out ways to get that from individual schools. But they've also done a really good job of partnering with folks like Chapin Hall or other universities and researchers who were interested in their work, so that the researcher couldn't just come in and do the research. The researcher had to help build their own capacity, understand what they were doing, so that it was a real partnership between the two organizations. I think that's the key with any of the groups that we've worked with, is that they have to have an interest, and most of our groups do, and they have to have access to people who have some knowledge, but who also respect what they're doing and are willing to engage them in discussions and help them build their skills as part of the work that they're doing.
Mm-hmm. Great. Bob?
So I think it's happening a little slowly, but I do think academia is responding to the need for training people who work in this area a little bit better. And what I would recommend, especially for organizations that have fewer resources, is to try to get an intern from a good quality public policy or even a computer science program, and a lot of kids these days, know a lot about computers, but they don't know as much about the field, and exposing them to kind of the real world issues of public policy, and some of them do have a commitment to social justice, even though they are nerds. They like to do that, and that's what I think Lena responded. There's a group of hackers out there who, now that they have this data, how can they make it useful to the organizations that we're talking about here? So I think one way to do that is to go through schools, but there's also websites out there that where you can make contact with some of these people. Meetup, Chicago Meetup is one of them, where you can find people who might be helpful.
Great. My question to the panel is, several of you mentioned the use of data in a punitive way, that there's a barrier toward the positive use and development of data because people fear that it's going to come back and bite them. Any thoughts on how we can begin to get over that, either from the funder perspective, from the intermediary or provider perspective? Is that just something we have to live with, or are there some ways to bring people together in a more constructive way around data?
I can speak to that a bit. So I guess the first thing I would say is change starts at home. So, and we've taken this to heart at the foundation at MacArthur. Something Nancy said, which I loved, this idea of using data it's a culture of learning. It's a learning organization that we strive to be at the foundation. And this means that we're holding ourselves, so we're also trying to track the impact of what we're doing all the time. Even as we're asking organizations to send in reports that tell us what they've done, we're trying to assess our own impact and to actually become that kind of organization where, I'll show you mine, you show me yours. That has to start at home. I mean, that has to start with us being able to do that within our own programs and being able to sort of break through the wall of every single thing you fund is going to be a success and every single thing you do is going to be, transformative. It doesn't work that way all the time. And I think the more that we can learn from failure and build a culture of learning from incremental progress and getting inside what is it that worked, what didn't work, the value of having an embedded evaluator. I mean, we take assessment very seriously and we try as much as we can. Fortunately, have the resources to do this, but we try as much as we can to ensure that everything that we fund is evaluated, and as much as we can that it's not just evaluated at the end, but that we have someone continuously informing us throughout the process about what is happening so that we're able to share that feedback. And I think that's what we've really tried to do with our grantees as much as we can, to build relationships where we are sharing that information. As you said, it's not just deliver the report and does it sit on a shelf. How do we have a dialogue and construct a dialogue around what has happened and what is happening? So I think that's
great. Anyone else want to take that on?
I think Elena said it all. It's that we all need to start creating a culture where we're acknowledging the fact that not everything we do is successful, but the data can tell us things that can help us be much more successful in the future. And look for those places where we can learn from what we're doing and from our mistakes, and then build off of that. And I think it requires the kind of dialogue that Elena is talking about, that we all have to be open to sharing what we've got, so that other people can learn from that as they go along as well.
Great.
And I would add, whether we like it or not, I mean, some of the things that you mentioned about performance-based, right? So, yeah, performance-based contracting, results-based, all of those sorts of trends, those aren't going away, sort of like it or not. And so I think, it puts, there is a bit of the punitive, I think, still out there, but I think the more that we can work together to overcome that, it's important.
Great. I think it goes back to the engagement issues that two of you mentioned around both practitioners and community members, that bringing them into the conversation too. So it's not just a funder beating up on a grant recipient or a contract recipient, but there's a broader conversation about that. Questions from the audience here. Wait, please, for 1 second for a microphone to appear, and then if you could just say your name and an organization if you are related to one.
Sure. My name is Cody Stevens. Currently unaffiliated with an organization. I agree with you, Chris, about local stakeholder knowledge being sometimes undervalued or not even heard. And I'm wondering if it sounds like all of you have experience with it, how you make sure that's valued at the table when you're talking about an evaluation plan or getting people invested in the evaluation from the start to the finish, and balance it with funder needs and balance it with some of the more hard-nosed data needs from these federal or state funders or city funders, while still valuing it and directing it sort of so that it can be more, I guess, packaged in a way that all the levels can appreciate it and it's still valued, but it's more directed to getting at the information to move the project forward.
I think it's always a dance that goes on, and creating opportunities and situations for people from all different levels of this conversation to come together and talk and learn from each other. I think one of the biggest challenge on this is time, that everybody wants the whatever program plan to happen today and get it underway because the needs are pressing. I mean, there's no denying that. And we often short-circuit the process in order to get to the product, and that undercuts those kind of conversations you're talking about. So I think what we really have to do is just understand it's going to take longer than we'd like it to, that we have to create space where people can have open and frank conversations. I think what we've seen that's worked really well is to create opportunities for more data-oriented people to come out to neighborhoods and actually engage community residents and folks who work in the neighborhoods in honest conversations, but then to also actually go out and see what they're talking about firsthand, because they learn from that and they see that there is actual value in that local knowledge. But at the same time, also creating opportunities for community folks to learn from data and have experts in data come out and talk to people in ways that are respectful, but also help build their own knowledge and capacity of the data so they can use it along with their local knowledge to build their plans and to improve their actions.
You know,
Go ahead.
Go ahead, Bob. Oh, Nancy? Okay, Nancy.
I will just offer the example in Englewood. When we were working the Neighborhood Recovery Initiative, we created a community. I mean, we worked with the community team around setting up criterion to, achieve X and what was needed. And the community table set the criterion, made decisions about grant allocations or subgranting, and then as performance data came in, it was that same table that said, well, we're making it happen here, but we have a consistent low-performing or non-performing partner, so we are going to reallocate some of the resources. All of that conversation, ownership, knowledge, and learning from data happened at that table. I did hear in my office later from the defunded partner, and it was really important to be able to say, and it was very real, that decision never came to my desk. Never came to my desk, should not have come to my desk. It truly is owned by, to Chris's point, owned by the community, engaged by the community, learning at the community level. So I think using processes like that, which do take time, are very powerful and effective.
So unless you have the context from the top that you're trying to improve services and improve the well-being of who you're trying to serve, it'll never filter down. And I think the leadership in all the organizations that I know that have done a good job of this, the leadership has been able to convince all levels within the effort, the organization, the initiative, that we're talking about improving services and improving what we do. And data, whether it's talking about, whether it's words or numbers, is an important part of that. But it's, oftentimes the leadership doesn't, come from our legislature or governor or our mayor, but it does come from individuals who are running these organizations and are committed to the outcomes that we're talking about here.
I have a question from the web, and then I'll turn back to the local audience. It's a meta question. How do we get better data on data use? Is there a way to understand whether funders, providers, community members are using data, and how do we track over time whether that's happening? Any thoughts on that?
So the Aspen Roundtable on Community Change has, earlier this year, they convened a group of mostly place-based practitioners who were grappling with the notion of what performance management means in the context of a very complex place-based initiative. And it was a really interesting meeting, and the paper is forthcoming. But I think there's a general interest in precisely this question of how we actually are using data. And so obviously internal self-assessment is sort of one way to start, but getting data on how it's being widely used, I think, is a really great question. And I think this Aspen effort was the first attempt to sort of bring together a community of practice among place-based practitioners, but there are some others as well. So there's an organization called Strive, which some of you may be familiar with, that's working on cradle-to-career pipelines in a number of places, and they're in sort of a rapid expansion mode. And I believe they, in their sort of expansion mode, and now with this national network of organizations trying to do that work, will be tracking how all of their different organization partners are using data, how that's working. Also, with the Promise Neighborhoods initiative, that is the same sort of thing. They're actually all trying to move towards using the same data system to track the results of the Promise Neighborhood grants. And so that's another effort where I think you'll see some of these national networks of people doing similar work where they are focused on performance management and how they're using data, what systems work better, what's too lightweight, what's too complicated. I mean, those sorts of questions, I think, may start to get addressed in that venue.
Chris?
I don't know that we'll ever be able to quantify it the way that someone might like to be able to put a number down and say it's up 33%. Be great if we could, but
Plus or minus 4%.
Plus or minus, yes.
Margin of error.
We've done the polling,
Right.
but I think we're seeing. I mean, already from a number of groups, there are ways to think about this differently. Are groups using data to talk to their boards of directors about the work that they're doing? So, one of our lead agencies in the past years added a data dashboard about their program performance to their board packet. Are they participating in things like our Data Friday, where they're coming in and talking about data? Do they own data when they're talking about their work? Do they use statistics as part of their discussion about why they're doing what they're doing? Do they use numbers and measurements and refer to data as part of their discussion about their successes of their program? I think it would be a huge step if we moved from somebody just saying, oh, look, Johnny's done better in school, which is important, and I don't want to discount that, to Johnny's done better in school, and so have X percentage of his peers, and here's how we know that. And I think those are the ways we'll be able to tell the answer to that question.
So I guess I have a counter question. I mean, if it's important enough, how will we, if using data is important enough, how will we see whether or not people are using the data? It goes back, and then the answer is, I think, it goes back to punitive. If it's going to be so important that if organizations aren't using data, if the DCFS providers weren't looking at the performance contracting statistics, they'll be out of business. Can you run a organization completely through the charisma of the leadership and having excellent political connections to funding sources and knowing exactly how to draw money out of out of potential donors? Maybe, but I think it's getting less. It's going to be less and less possible to do so.
Great. Question here in the front.
Hello, my name is Dominica McBride. I'm with the HELP Institute, and we provide free and sliding scale program evaluation to other nonprofits. We're a nonprofit organization that collaborates with other nonprofits to actually do this kind of work and using data. My question, a couple of you have, well, actually 3 of you really focused on collaboration and kind of team building around these issues. So you talked about a model in doing that it needs to be created, this model. Could you talk about some of your experiences that have shaped the way that you've seen, I don't know, a possibility for a really good model in this area? Some methods around good collaboration, strong collaboration.
Who would like to take that on? Chris, do you want to start on that? Nancy?
Go ahead, Chris.
No.
Okay, I'll take it. I'll give you maybe 2 examples. The Chicago 6 is a collaboration of provider organizations, nonprofits, who are doing early childhood. Spent a lot of time with the execs first saying, what will we commonly measure, right? What is it we are going to track? What's the tool we're going to use? How will we bring the data that we're learning from our own performance forward so that we can drive improved services at the child level? So there is a collaborative of early childhood providers who are using a comma data system and coming together on a quarterly basis to look at the data and examine and wrestle with. It took quite some time, probably 2 years of developmental work to understand what was going to be measured, et cetera, and to get to the point now where they are serving up data and talking about the actual practice. Similarly, in the Englewood work that we're doing at the collaborative table, we talked about what it was we were going to measure for the community-wide. Then we Children's Home and Aid, as anchor agency, found funding for laptops for every partner at the table and interns to help us with the data input piece so that everyone, all the community partners, could have the true capacity to collect the data and then learn how to look at the numbers that come through, pushing the button and ask those important developmental questions. How can we get better? What does this tell us? What else do we need to know? But there was, again, it does take a great deal of time to have the trust and then to agree upon what the questions are, what's the theory of change, what will we measure, and have the trust to be able to say, gee, I wonder how everyone else did because I think my numbers are terrible.
I would add, if you haven't seen it, so Mark Kramer and John Kania put out a paper in the Stanford Social Innovation Quarterly in January 2011. It was called Collective Impact. And I think why it was useful, a lot of people saw them, they laid out a sort of 6-point plan for how organizations do just this. How do you actually get a collaboration around a very complex problem-solving endeavor? And one of the elements is shared measurement systems. That's one of the things that they identify. But they also get at some of the other sort of non-data, the importance of a shared table, like having one table where there's sort of a neutral facilitator that actually has a lot of us have talked about that. But I think so the article nicely lays out that framework, but also because I think a lot of people saw themselves and their initiatives inside of it when it came out, like we're doing collective impact, everybody's doing. So now I think there's been quite a few follow-up articles, and I think that framework, check out Stanford Social Innovation Quarterly and other places like that. I think they're doing a good job of, trying to kind of identify some of the. Can you repeat the authors' names? Mark Kramer and John Kania.
Great. In the back. Matt?
Mm-hmm. Did the legislation, Kim Zalent from BPI and Business and Professional People for the Public Interest, did the state legislation on creating a student ID number or child ID number help or hinder, or where is that? I mean, I think it's interesting. We haven't heard anything from you about it.
Bob, do you want to take that? Okay.
I think it's very symbolic of the desire of the state to do a better job of being able to track children across schools over time and do the type of evaluation that's needed to in the context of school improvement that's being talked about everywhere right now, evaluating teachers and evaluating schools. So I think it's an important step and symbolic of a commitment to that. It is being implemented, and it's being actually brought down so that kids in early childhood programs get assigned the same number so that it follows from early childhood through 12 or 16 or 20, P20. So that is certainly the notion. Once you get beyond high school, I don't know exactly how well it works because kids go to college all over the place. And there was even at some point a effort to bring it down to that it's assigned to children at birth. But again, there's a lot of challenges to doing it. There's a lot of mobility. You have to rely on schools to be able to, when a new child comes, to be able to find their student identification number. If the students don't have it themselves, you can't rely on families to keep it around. So it puts more of a burden on the local provider, on the school, on the local entity to maintain that. And there's all sorts of problems. There's a golden rule in this type of work that there is no such thing as a unique identifier. Social Security number doesn't work as a unique identifier, even though most people have one in this country. So that's why I go back to saying it's symbolic of a commitment to trying to do better around analysis of school outcomes for children.
Good. I'm going to turn to Chris. Did you want to add
Yeah, I
to
just
that?
want to, because I think Bob actually read the thing earlier about the requirements for consent forms, and that even if we had this and everyone was implementing it perfectly and it worked and it was the golden answer that we're looking for, we have to remember the impact that this stuff still has on our community partners and the work that they're doing, that they still have to have staff who can go out and get the consent forms signed, and they have to create the data systems in their local places, and then they have to be able to manage it. So we have to remember that we have to support groups. Even when we have the perfect system, the groups still need all kinds of support and capacity to use it to make good decisions and to be able to use it to improve their programs.
Mari first. Okay, Paige, go ahead with that woman, please. Thank you.
Good morning. My name is Jean Carter Hill, and I am the co-founder and executive director of Imagine Inglewood IF. This question is to Nancy. Is there anything in place to have training for parents around data? I'm very concerned about attendance. I'm about a couple blocks from Robeson, and the attendance is just terrible. And I think that parents don't understand how important it is that children should be on time and that it plays a part in their education. We're a nonprofit organization, and we have after-school and Saturday classes. So is there anything planned for parents to be trained around the data that we're talking about so they can be more, can understand it, so they can understand and know it plays a big part in their children's success?
Thank you.
Thank you for your fabulous leadership. Also, Imagine Englewood IF is such an important community resource and partner, and that's a great question. I am not aware that in any of our parent support groups we have using data and becoming users of and analyzers of and leaders of information. It is not incorporated in our parent work, and I think that's a fantastic idea. So I think what I want to do with that idea and that spark is bring that back to the staff who we have programs, but also bring it to the community table, right, where we sit together and ask how we can build that into our engagement with parents. It will drive improved outcomes and well-being for children. So great insight.
Mari, here.
I'm Mari Gallagher. I have my own research firm, and I'm affiliated with the National Center for Public Research. My question is for Bob. There is so much data out there these days. We were talking about that, but there's actually a lot of individual level data that's more proprietary that companies develop and they sell to some degree. They link it with other data, or there's data that's collected that we opt into. Right, we might on our smartphone opt into different apps that track different things. Either we're aware of that or we're not aware of that. Parallel to that, there are some people saying, and I'm not advocating for this or saying it's necessarily true, but there's some people saying that younger generations, because they're on Facebook, they're doing all these different things, that they have fewer concerns about data privacy, that we're probably moving into a future where we're going to even have lots more data. But my question is threefold on that for you. One, what is your vision of all this individual level data? That, again, that's very specific. That might be like, how much I'm projected to make, where I live, all my different customer, a whole bunch of different things that could be collected about me and all of you. Two, do you think that in the future that we're going to be able to have the same level of data protection for children, like that attendance data, which frankly would be great to have, right? But there's a lot of issues with it because we're maybe moving into a future where there's a different culture about data, or the floodgates have opened. We just can't protect it. It's out there. We can't. And then 3, now and in the future, how can communities get this kind of data? Because this kind of data is out there. Companies are using it to profile us and sell us things. There's all different kinds of uses for this data, but I don't know if it's necessarily trickling down to the neighborhood level, where we could do meaningful community-type analysis that would help improve communities. So data, data, data.
I think that when you talk about all the social media data, work's been done with around kids' cell phone usage. Researchers are starting to use how kids communicate among themselves. They give them BlackBerries, and then they track all of their emails and texts to do that. Anybody can go on Twitter and geographically look at tweets in a particular geographic area. Go look at the tweets that are happening in some of our more violent communities. It scare the out of you. Kids are using Twitter to communicate whether or not they're considering suicide, whether they're considering killing somebody else, whether they're how they feel that day. It's quite amazing, and so I think it's a great source. There's a study that's been done recently that individuals who are under the age of 24, the representation of that group using social media and obviously cell phones represents the population extremely well. I think researchers can begin and communities can begin to use this. How we do that, jumping to 3, is through, I think, some of these hackers and young talented people who are using this data. They don't know what to do with themselves, and so everybody's making a CTA route finder, and that's great. That's very important, public transportation, but we don't need 300 of them. We need one that works well. I think using Twitter, using Facebook, using these tools, trying to find ways to get Verizon and AT&T to share data in a de-identified way that still kind of connects to communities would also be useful. Public utility data is also important. How people the use of utilities and tracking that is important for energy use and that type. So I think all this kind of non-public sector data that is out there is tremendously useful, and there has to be pressure put on some of the proprietary groups to try to make data sets available to push this forward.
Very useful. I have time for one quick one-part question. So this gentleman here has been waiting a while.
Hi, I'm Kyljun Kim from Chicago Public Schools. If you live in Chicago long enough, you sort of start seeing a lot of new initiative coming up every now and then. But then when you see the neighborhoods that get the attention from foundations and academics, it almost always inevitably go to those places that we've seen before, Englewood, North Lawndale. That is not to say that those neighborhoods do not deserve the attention, but that tells me two things. One, after decades of looking at those neighborhoods, one, things are not changing. Two, those other neighborhoods that really have similar conditions, I'm particularly concerned about first-ring suburbs that are decaying but not getting the attention that they also deserve. So I was wondering if you can sort of address sort of that geographic inequity about resource allocation a little bit.
Great. Who would like to take that on quickly? We have about 2 minutes left to answer a very complex question. Nancy?
Children's Home and Aid built an early childhood center in Schaumburg, and it was the biggest steep climb we ever had to tackle because no one thought there was any poverty in Schaumburg, much less, a host of family problems. So I do think we have an obligation to communicate more effectively and in real time, because to Robert's point earlier, people move. Problems can follow families because they're not equipped and resourced. So I would just say we need to do a better job of opening that up and ask our funders to be a little bit more open-minded about where those needs are and where we can be proactive.
Great. I think that's a nice concluding comment, because if we're successful in using this flood of data well to measure child well-being at a very precise geographic level, that will be a resource that will change the way policymakers and funders think. 40 years ago, you had more emphasis on the connections people had or funding the people who you funded last time, and now there are data resources to think more broadly about that. So I'm afraid we're out of time. We can continue this conversation in a couple of ways. One is for those who ask questions via the web that were not addressed, we will get back to the panelists and try to get back to you to answer those. We also, most of our panelists can stay around for a few minutes if you want to come up and chat. A couple of them have pressing obligations and we'll have to move on. But I think we've opened a topic here that we're likely to come back to again and again. It's a very fast-moving area. I want to thank our panel for putting it out there from a variety of perspectives, generating a lot of great questions. I want to thank the audience here in person as well as on the web, and look forward to seeing you at our next Child and Family Forum. So let's give a round of applause to our panel. Thank you.